The 2020-2021 Singapore Circuit Breaker measures was a stay-at-home order and cordon sanitaire, implemented as a preventive measure by the Government of Singapore in response to the COVID-19 pandemic in the country on the 7th of April 2020. Officially, the measures were enforced by the COVID-19 Regulations 2020, published on the 7th of April 2020. By May 2021, Singapore was in its third phase of lifting its circuit breaker measures. However, the nation returned to Phase 2 on the 8th of May 2021 for 1 week, before going into heightened alert from the 16th of May 2021 in view of the rise in community cases as resulted from the Tan Tock Seng Hospital cluster of COVID cases emerging from its wards, a cluster at Changi Airport, and the emergence of new mutated variants of the coronavirus. Singapore recorded its first COVID-19 case on the 23rd of January 2020. While initial cases were all tied to travelers, on the 7th of February 2020, Singapore raised the disease outbreak response system condition level from yellow to orange in response to additional local cases of uncertain origin. On the 24th of March, the multi-ministry task force announced more stricter measures to combat the spread of COVID-19, after a huge spike in cases originating from returning Singaporeans in the community. These measures include the closure of entertainment venues, tuition and enrichment centers and places of worship. Malls, retail establishments and tourist attractions were required to reduce their crowd density in order to stay open. Gatherings of more than 10 people outside of work and school are prohibited. On the 3rd of April, Prime Minister Lee Hsien Loong announced a nationwide partial lockdown, known as a circuit breaker, to contain the spread of COVID-19 in Singapore. These measures came after an increase of unlinked cases over the preceding month, as well as the risk of a huge cluster of infections. All non-essential workplaces closed from the 7th of April, with essential workplaces remaining open. All schools transitioned to home-based learning from the 8th of April. All food establishments were only allowed to offer takeaway, drive-through and delivery of food. In addition, the wearing of masks by healthy individuals was no longer discouraged. These measures would initially lapse on the 4th of May. On the 14th of April, then Minister for National Development Lawrence Wong made the wearing of masks compulsory when not at home with immediate effect, with fines and prosecution for offenders who refused to do so. After discovering that the unknown number of cases was greater than expected, Prime Minister Lee Hsien Loong announced on the 21st of April an extension of the circuit breaker to the 1st of June. Existing measures were also tightened until the 4th of May initially, including shrinking the list of essential services, such as closing all close contact service providers such as hair salons, as well as restricting entry to certain hotspots like wet markets and some essential retail franchises going by the last digit of one's ID number. Popular markets utilized an odd, even date entry restriction. ID ending with odd numbers are only allowed entry on odd dates of the month, and ID ending with even numbers are only allowed entry on even dates on the month. The Singapore franchise of McDonald's also shut all of its restaurants island-wide, as a response to a number of its employees being infected. Some restrictions were relaxed progressively in stages to prepare for the end of the circuit breaker on the 1st of June. Traditional Chinese medicine, manufacturing of confectionery, and laundry shops on the 12th of May. Schools resumed face-to-face lessons for smaller groups in graduating cohorts and those requiring urgent assistance on the 19th of May. At the same time, the Ministry of Health mandated the use of safe entry contact tracing system at all businesses and services from the 12th of May, but does not include transient locations like the MRT or parks, although people are encouraged to scan to assist in contact tracing efforts. On the 8th of May, the MO announced that all TCM shops are allowed to sell retail products again from the 12th of May, after receiving feedback from seniors that traveling to TCM medical halls was too far for them. 3 phases of planned reopening were announced on the 19th of May. Namely, safe reopening. The third phase will last until an effective treatment or vaccine is found to stop the spread of COVID-19. which was approved in December 2020. Phase 1 started on the 2nd of June, while Phase 2 started on the 19th of June. Phase 3 started on the 28th of December with preconditions like the use of trace together, compliance with safe management measures, and adequate testing capacity. In addition, it was announced on the 14th of December 2020 that the Pfizer-BioNTech vaccine was approved for use in Singapore, with the first batch slated for around end of December 2020. On the 3rd of February 2021, the Moderna vaccine was approved for use in Singapore, with the first batch slated to arrive around March 2021. Subsequent batches for both vaccines are planned to arrive throughout 2021. After a resurgence of COVID-19 cases in the Camus